Hi, I'm with Dr. Sega Moges, and he's one of our anesthesia residents here at Rush University. He's rotating through his regional service right now, and I figured this would be a great opportunity to catch him and ask him, what fueled your passion towards medicine? How did you end up here? And then why anesthesia? So I'm going to hand over the mic.
Thank you, Dr. Suvar. So I think these are excellent questions, and the story is a little convoluted, much like my path in medicine. My interest in medicine was always pretty nascent. My dad was a physician. I grew up around textbooks, and I was always fascinated with what my dad did, as any kid is. But on my path there, I took a lot of twists and turns. The first one was when I was in undergrad. I thought I might get a PhD. I was really interested in immunology, and there's a lot of interesting work I was doing there. But I realized that research wasn't quite for me. And then I started med school. And while I was in med school, I got my MBA as well, because there was always an interest in the intersectionality of business and medicine. While I was doing that, I helped a buddy get a medical device company off the ground, and that sort of got me down an interlude doing investment banking for a bit. But at the end of the day, I knew that I wanted to at least have some tangible real-world experience dealing with patients. So that's what brought me back to clinical medicine and brought me back, to Rush now. But really the interest that I had in anesthesia was when I was going through all of my rotations. I fell in love with being in the OR, but didn't exactly see myself being a surgeon. And one of the things that I always thought was very satisfying was alleviating patient discomfort. And I think as anesthesiologists, we have a uniquely intertwined mandate to treat pain. And so, that really dovetails into why I'm going to go do a regional fellowship next year.
Awesome. Thank you so much for sharing your story. Can't wait to see all the great things you do in the future.